It's really great that we're on the agenda straight after Alison and Susan, because what I'm going to talk about is how that collaboration has then played into the collaboration that we've done at the hospital level to help make sure that patients stay safe, stay at home, and we make arrangements to get medicines to them. So we're based in Nottingham, in the heart of the East Midlands. We're a large acute NHS trust, and we provide services to over 2.5 million residents in the 6,000 square miles that cover Nottinghamshire and the surrounding counties. We'll just move on a little bit. The 3 sites with 90 wards, an emergency department, children's hospital, cancer centre, heart centre, and a wide range of outpatients. Medicines are the responsibility of the Trust's pharmacy department, and there are a number of components of what the pharmacy service does. But one key part of that is dispensing medicines to outpatients. And outpatients often need new or updated treatments with medicines. Many of the medicines are specialist, complex, high risk, high cost, and they're often needed for a medium or long-term basis. Next slide. So the dispensing of medicines to outpatients in our hospital is organised using either the on-site pharmacy or a medicines home care service. The majority of the dispensing happens with the hospital-only paper prescriptions at the on-site pharmacy. And there are 3 pharmacies which form the Trust's wholly owned subsidiary pharmacy company. The pharmacies are located in the main thoroughfares of the hospital. They're very busy places. They cater for a large number of patients, and the pharmacy is usually the last stop on the patient's journey through the hospital. Patients often have to wait a little while the prescription is dispensed. But alternatively, some patients who have ongoing treatment have it arranged with the medicines home care team. The team use independent home care providers for specific complex treatments, especially when they need additional items like needles or disposable bins and numbing cream supplied, or where nursing care is required to administer the medicines or train the patient. And these arrangements were working really well until March 2020. And then this man was on TV. And he told us that people needed to stay at home. They needed to socially distance and shield if they were vulnerable. Social distancing was extremely difficult in the busy pharmacies. Waiting for prescriptions increased the risk of spread. And whilst a small proportion of patients were enrolled with home care services, most patients visited the hospital pharmacy in person. So for many patients, collecting medicines was often a key driver and a main reason why they were visiting the hospital. So patients and staff quickly recognised that the arrangements for outpatient medicines needed to change, and the pharmacy set about providing an alternative to on-site attendance for the purposes of obtaining medicines for at least 20% of patients. A broad range of potential solutions were considered. We thought about click and collect. We contemplated setting up a drive-through pharmacy. We thought about relocating the pharmacy or diverting work to community pharmacies. And we also considered home delivery. We thought about each of these options in terms of whether they could be implemented quickly, what capacity they had, what resilience and safety arrangements were in place, and the accessibility for vulnerable patient groups, as well as the COVID safety measures that they could put in place, and the impact for patient experience. And we settled on home delivery as being the best fit solution for us to move forward quickly. So to achieve the scale of change that we were looking for, our team responsible for expanding the home delivery service needed to work across organisations with a wide range of stakeholders. To overcome financial barriers, we liaised with finance colleagues and commissioning teams. To enrol more patients into home care services, we worked with the National Home Care Medicines Committee, regional home care leads, and the home care providers themselves to map out their providers' capacity and what we could tap into. We had to work with ICT and estates teams to help us equip our staff to work effectively on and off-site. And HR and volunteer services helped us work through the working arrangements for these rapidly evolving circumstances. To develop and communicate the new ways of working, we spoke with specialist clinicians, pharmacists, and patient groups, and new processes were reviewed with urgency by the appropriate committees. Throughout, we ensured that our developments were aligned with the organisation by working with the Trust's pandemic response team. And daily leadership meetings helped make sure that innovative and creative problem solving was applied, whilst also expediting progress and rapidly clearing obstacles that were in the way. Implementation began within a few days. Innovative solutions were identified to resolve problems that we'd not previously had to even think about. Problems like remote working, the local geography, and immense pressures that we were facing for the workforce. To provide a next day delivery service from the on-site pharmacies, the storeroom was repurposed where the medicines could be safely repackaged and distributed. A hub and spoke model was used to collate medicines from dispensaries across all hospital sites, ensuring efficient distribution across the 6,000 square miles that we serve. 7 pharmacy delivery drivers were recruited, including volunteers supporting the NHS during the pandemic. Equipment and training was provided, not only just to make sure that we were protecting the clinically vulnerable patients, but that we were thinking about making sure that that service was friendly, caring and helpful. Home care provider capacity was prioritised for treatments that required nursing support or training to administer. New technology was implemented to enable staff to authorise and check the prescriptions from home, and new procedures were put in place to meet medicines and data regulations. Shielding staff who had to stay at home themselves were involved, and that freed up other staff to help with frontline responses. The quality and safety benefits of interactions with pharmacy professionals were maintained by telephone contact, and pro forma were developed to help us make sure we were giving the information to patients that they were asking for, information about side effects and the purpose of the medicines. We did a lot to make sure the initiative was communicated widely, both inside and outside the organisation, using posters, screensavers and newsletters, but also holding Zoom presentations to clinicians to make sure they understood what we were looking to do. A press release received widespread coverage, and we were able to publicise the initiative on BBC News and BBC Local Radio, as well as online and printed news outlets and social media. So we were able to make sure there's really high level awareness amongst patients as well as staff within the hospital. So next slide, please. The initiative started getting results within just a week. Use of home care schemes was expanded, and the on-site pharmacies created the infrastructure, systems, process and teams to deliver over 100 patients every day. Urgent, planned and complex medicines were all accommodated, and 14 clinical specialities were able to use home care services providers that they hadn't done before, so the number of patients enrolled quickly started to increase. Within 12 months, more than 25,000 individual patients were able to avoid a trip to the hospital. And we achieved our aim of providing an alternative to on-site attendance for the purposes of obtaining medicines for more than 20% of our patients. Not only did this enable those specific patients to stay at home, but it meant that the rest of the patients that were in the hospital were able to safely social distance and attend more safely. So as well as helping people keep safe, we actually found some other good results as side effects from this process. The telephone consultations with a pharmacy professional led to lots of interventions to improve patient safety and improve the outcomes from the medicines. Patients were advised how to take the medicines correctly and what to expect, what side effects to look out for and so on. And with the conversation taking place away from the hospital, they were a lot more comfortable to share some concerns. We talked about things like how their treatment would interact with the COVID vaccine and what effects their medicines might have on their immune response, as well as things around what they might have read in the leaflets. The home delivery was overwhelmingly well received and appreciated by patients, especially those who were vulnerable. Patients posted more than 80 5-star reviews on the NHS website, and questionnaires consistently showed approval ratings over 90%. The impact is most clearly described in the words that the patients use, though, when they say things like, "It's a lifesaver," "It's invaluable during isolation," and that they're incredibly grateful to the NHS. That shows what it means. We also identified really high levels of satisfaction from the staff that were involved, and they've really found that they were able to contribute to something that was making such a difference for people, keeping them safe during this time. Going forward, we expect the service to keep growing by continuing to adapt and develop the service in response to what patients are telling us they need. The processes that we use continue to be evolved and made more efficient to help us reduce the costs and secure long-term funding. And as we emerge from the pandemic, changes to the outpatient pathways that have enabled care to closer to home, things like video appointments and telephone consultations, are likely to remain in place. So this means that NHS trusts, commissioning organisations and all sorts of groups, and most importantly patients, are looking for streamlined ways of getting their medicines safely and with the right support and advice. We found this dual strategy of maximising home care uptake and instigating a home delivery service from the on-site pharmacy has been a really effective solution, offering both next-day delivery service for acute medicines and scheduled delivery for the most complicated treatments. It ensures equity across all these different patient groups, irrespective of what kind of medicines they need and how it's needed to be used. Thank you.